I've been in the Medicare business now almost 15 years, and I truly love what I do. But there's one thing that I absolutely hate about Medicare, and that is all the misinformation and bad advice that people receive from others. Now, that bad advice could come from someone working in a Social Security office that's not adequately trained. It could come from a rookie agent. It could come from a Medicare consumer, someone that's already on Medicare and really doesn't understand Medicare. It could come from a sales ad, something you see online, or maybe even a television ad. It can even actually come from an HR department. In fact, I once had a lady who came to me that was told by her HR department that she was retiring and didn't have to go on Medicare because the company was going to pay for her COBRA insurance for 12 months. She acted upon that piece of advice. It was terrible advice, and during that period of time while she's on COBRA, she had about $100,000 worth of medical bills. And because she didn't go on Medicare, that COBRA plan only paid second to Medicare. And so that advice cost her $80,000. And I don't want that to happen to anyone. So in this video, I'm going to share with you the 5 most dangerous pieces of advice that you need to avoid. All right, let's look at the first piece of bad advice that you may hear, and that's this one. That is that everyone must enroll in Medicare Part A at 65. Now, it is true that there are some that must enroll in A and B at 65, but not everyone has to start Medicare at 65. So let me explain who has to. Who has to go on Medicare at 65, meaning they have no other options whatsoever. This would be anyone that is covered by a retirement insurance plan, either their own or their spouse's. So if you're covered by a retirement plan, you have to go on Medicare at 65. If you are presently on COBRA insurance, and that's what you're using, and you're approaching 65, you got to go on Medicare. And the reason for that is because the COBRA plan may get you to Medicare eligibility as the first payer, but once you're Medicare eligible, A and B has to pay first, and the COBRA plan is going to only pay second. So if you don't enroll into A and B, you become the first payer because COBRA only will pay second. So anyone on a retirement plan, anyone on a COBRA plan, anyone on an Affordable Care Act plan, you went through the healthcare exchange, the marketplace to buy an individual plan or maybe in a family plan. But if you're approaching 65, what happens is technically you can really keep an ACA plan beyond 65, but you wouldn't want to because all the financial benefits go away. You will no longer get the tax subsidy. You'll no longer get the cost sharing paid by the government, the reduced premium. You'll not get any of that. You'll pay full premium, full deductible, full out of pocket, everything. And so there's no reason to keep an ACA plan once you're 65. Anyone that is retired from the military, you're eligible for what's called TRICARE insurance. But once you're 65, TRICARE no longer pays first. It only pays second. You have to enroll in Medicare A and B at 65. And then lastly, the fifth group would be anyone that is still working. Now watch this. This is the key. Anyone that is still working and covered by, or their spouse is still working and covered by an employer-provided plan where there's 19 employees or less. 19 employees or less. And those could be part-time, full-time, doesn't matter. We have 19 people on the payroll. If that's your group or less, then you're required to go on Medicare. And the reason for that is because the group plan that has you covered is only obligated once you're 65 to pay in the second payer position. So you have to enroll in Medicare A and B to put them in the first payer position. Again, if you don't, just like COBRA, you would become the first payer. And so that's the 5 groups of people that must go on Medicare at 65, covered by retirement plans, ACA plans, TRICARE for life, COBRA, or employee where there's 19 or less employees in that group. You've got to go on Medicare. But does everyone else have to? And the answer to that is no, you don't. And so that means that there are people that are still working and they're covered by an employer-provided plan. Again, it could be your spouse is working, but you're covered by an employer-provided plan and there's 20 employees on the payroll or more. You don't have to do anything with Medicare whatsoever. You don't have to take A, you don't have to take a B. But you'll have many people who say, no, you've got to enroll in A even if you're going to keep working. And folks, that's not true. And the reason they say that is they say if you don't take A at 65, then you're going to be penalized. And that's also not true. You see, the only people that are ever penalized for Medicare Part A are people that have to buy A. And the ones who have to buy A could be penalized. But if A is going to be zero premium for you, which is basically free to you, there's never a penalty for Part A. And folks, that's 99% of the population. Only 1% of the Medicare population actually has to buy Part A. So if you have 40 quarters, which is what? 10 years worth of work. that you've paid into Medicare taxes or your spouse has, then your Medicare Part A is going to be 0. Therefore, there will never be any kind of penalty, and you don't have to take Medicare at 65. And I promise you, you will not be penalized. Okay, now you may get that advice from a Social Security office. You may get that advice from some rookie Medicare agent or someone else, but they're wrong. You'll never get a penalty as long as you have 40 quarters, and Part A is going to be 0 for you. So you don't have to take it at 65. Why do I even take the time to teach about this? Here's why. Because if you're still working, again, group 20 or more, and you have what's called a high deductible health plan. With that also has what is called a health savings account. And if you have a health savings account, you're contributing that money in. It's a tax advantage medical expense savings account called an HSA. If you do take A, you can no longer put money into your HSA. And so it's not going to benefit you by enrolling in Part A usually if you're on a group plan, because Medicare A is in the second payer position. They won't pay any copays. They won't pay any deductibles. They only pay coinsurance. So I think it's far greater to go ahead and contribute to your HSA while you're going to still working if you have that as an option. That's the point. Okay, so you don't have to take A. Now, let's say you're still working. Again, group is 20 or more, you or your spouses, and you don't have an HSA. Then it is perfectly fine to enroll into Medicare A only. It's fine to do that. You're not going to be hurting yourself. And again, they may pay something, but they are still in the second payer position, paying no copays, no deductibles, only coinsurance. All right, so it's all right to do it. But it is truly bad advice when people say you've got to start A, and if you don't start A at 65, you're going to be penalized. That's absolutely not true. If your Medicare A premium is 0 because you have 40 quarters, 10 years worth of work paid in, you'll never be penalized. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. Now, the second piece of bad advice that you may hear is that you have to actually wait until you retire before you can start Medicare. And again, that is absolutely not the case. Now, it is true that you may wait until you retire to start Medicare. We just saw that in the last slide. As long as you or your spouse are working and there's 20 employees or more at that company, you don't have to do anything with Medicare A and B. You don't have to, but you still could. And so when people say, no, you can't go on Medicare to retire, that's not true. There are lots of people today that are still working. And again, they have group plans of 20 or more, but they have found that their Medicare option is better than their employer option. And so the point is, you don't have to wait. You can start at 65. And so the key to that is, as long as you're eligible to start Medicare, you have 40 quarters, or your spouse does, 10 years worth of work paid into the Medicare, you can start your Medicare at 65. Now, when we do that, that is called our initial enrollment period, which lasts for 7 months. Those 7 months are 3 months before we turn 65, the month we turn 65, and then 3 months after. That's a 7-month window where we actually self-enroll into Medicare at 65. And if you're working and your work plan is not as good as your Medicare option, then you can enroll into Medicare. You don't have to wait until you retire. You can start it at 65. Now, let's suppose that your group plan is good and you do like it better than your Medicare option. Then you don't have to do anything with Medicare as long as there's 20 or more employees at the company. You will come into Medicare at a later date, and that later date and the enrollment period is called, and so this is at 65. So at 65 plus, let's say you're 66 or 67, you're going to come in an enrollment period called the special enrollment period. And that is a different process. All we have to do is verify that you have had employment and insurance, you or your spouse, back to 65. We have to prove that with a form called an L564. We pick the date we want to start our Medicare. And so you're not required to wait until you retire. But if you do wait until you retire and you're going to come in a later date, again, it's just going to be a different enrollment period. So it's fine to do that. And so again, the point is, be sure that you know that you don't have to wait to retire. You can start at 65. You just want to do a simple comparison. Now, I would tell you this, that employers do have the legal right, number one, they have to let you go at 65. They have to let you go on to Medicare if you choose to. Okay? They can't make you do that unless you're in a group of 19 or less, but if it's 20 or more, they cannot make you do that, but they can allow you to do that if you want to. And then what some companies will do as we move forward, let's say you're 67 years old or 68 and you're still working and you now are ready to go on Medicare. What companies can do is they can say that the time you make that switch off the employer plan onto Medicare is during the company's open enrollment season. They do have the legal right to do that. Now, frankly, a lot of companies will let you go anytime you want to, but some won't. They only let you go during that open enrollment season for your employer-provided plan. All right. Okay, so the whole point is you don't have to wait. You can start Medicare at 65 or beyond if that is your best option. All right, this third piece of bad advice has to do with different options for insurance. Whenever you go on Medicare A and B, beyond A and B, most people are going to get additional insurance, and really there's only two options beyond A and B. You can stay in A and B and get a supplemental plan to fill in the gaps that Medicare doesn't cover, or you can replace A and B with what is called an Advantage plan or a C plan. And those are your two options. You have to choose one or the other. You cannot be in both at the same time. But there are some that want to give the impression that the Advantage plan and the supplemental plans are very similar. And I would tell you that absolutely is not true. In fact, these two insurance systems really only have one thing in common. So they are very dissimilar, okay? And so the only thing they have in common, if I am going to enroll into a supplemental plan, I have to be enrolled in A and B. And then I get my supplemental plan. Most people today are getting a G plan or an N plan. All right? And then in this scenario, then I add a prescription drug plan to my coverage as well. All right, now if I take an Advantage plan, the other system, what happens? I again have to enroll in A and B. And then what I am doing is I am then enrolling in a private health insurance company called a C plan or replacement plan, also referred to as Advantage plans, all right? And so these two systems have one thing in common. You've got to be enrolled in A and B, which means you got to pay your B premium. Over here, got to pay my B premium. Now, right now, that's $164.90 a month for most people. Now, this is all based upon your modified adjusted gross income. So if you're a single filer and you're below $97,000 modified adjusted gross, then that would be the accurate premium for 2023. I'm shooting this video today. It's August the 15th of 2023. And so it's $164.90 a month for Part B. Whether that's a supplemental plan or Advantage plan, I have to be enrolled in A and B. If you're a couple and your modified adjusted gross income is below $194,000 or less, then again, that amount would be accurate for your Part B premium. If you're above that, then you have to pay additional money. Those are called IRMAs or surcharges. I'm not going to get into that right now. So as we talk about these two systems, they are very dissimilar. All right, the only thing they have in common is this B premium. So the issues between them, there's a couple that I want to note during this video. Number one, difference between these, it would be providers that are available to you. Providers. All right. And so providers are different. Now, why is that? Well, because on supplemental plans, you can go to any provider that takes Medicare. Okay? And I mean any provider, any hospital, any doctor, any surgeon, any outpatient surgery, ambulatory surgical center. You can go anywhere you want as long as they take Medicare. You don't even have to ask them if they take your supplemental plan because they have to if they take original Medicare. Now, that's different over here on the Advantage plans. Now we're going to have HMOs and PPOs. And so you most certainly have to ask your provider if they take that plan because, frankly, some doctors will take both HMOs and PPOs. Some may take one or the other, and some will take none of them. There's just some providers that just say, I'm not going to take Advantage plans. And so here we almost have, not quite, but we almost have unlimited choices. Over here, we're definitely going to have limited choices and restrictions because we're dealing with networks. Not everyone is going to take them, but if you're going to use the benefits on the Advantage plan really to their fullest, you want to make sure your providers are in the network. Number two, and that has to do what we call pre-authorizations. Now, before I get into exactly what these are, I want to make sure you understand that not every single service that you're going to have on an Advantage plan is going to require pre-authorization. You can see your primary care doctor, you can see a specialist, you can have basic lab work, you can get your preventive done. There's a lot of things you can do without it having to be pre-authorized or pre-approved. But they say right now about 70 to 72% of the services that someone that's enrolled in an Advantage plan is going to need, it's going to have to be pre pre-approved by the insurance company, which means doctor says, we want you to have an MRI or a CAT scan or a PET scan, or you need a knee replacement or a hip replacement, or we need to have surgery on an outpatient basis or inpatient basis. All those items are expensive and are going to have to be pre-authorized, pre-approved by the insurance company. And so the doctor in this system does not have the final say so. Doc says, I'm recommending this, or we're going to get this, try to get this approved, but the insurance company in this system truly has the final say so. Now, sometimes they will immediately approve it, but sometimes they delay the approval. They'll put that off for 4 weeks or 8 weeks, or they can flat deny it. And they say, no, we don't believe you need a full hip replacement. We're going to pay for a rod only, or we don't believe you need a knee replacement. We think you go to therapy, that's sufficient, or we want you to take shots for a time. But they have these requirements called pre-authorizations, and you have got to be content with that if you decide you want a Advantage plan because your doctor doesn't have the final say so. Well, over here, basically, we have no pre-authorizations by the insurance company. They'll say nothing. If Medicare says they'll cover it, doctor says you need it, end of story, it's on the schedule, and you're going to get that knee or hip replacement or that CAT scan or whatever it is that the doctor's recommending. So again, these systems are not the same when it comes to pre-authorizations. And then the way that you pay. The way you pay is also different. An Advantage plan is what we refer to as a pay-as-you-go. Pay-as-you-go. Now again, we have had to pay our $164.90 for our Medicare Part B, but usually Advantage plans have zero premium to the insurance company, and they'll also include a prescription drug plan at a zero premium. So you have the premium is only the Medicare Part B usually, but instead of paying a premium over here, what I'm doing, now I'm going to pay as I go. I see a specialist, it may cost me a $50 copay. I go to the hospital, maybe $300 to $350 a day, up to maybe 5, 6, 7 days every time I'm hospitalized. I have a cataract surgery or a knee replacement, hip replacement, probably going to cost me $300 for that surgery. So as you can see, it's a copay system. So we pay as we go. We pay copays. If you had chemotherapy, it's usually co-insurance. So my point is we're out of pocket over here based upon the healthcare services we need until we hit what's called the annual max out of pocket. Max out of pocket are called MOOP. On HMOs, it's normally about $3,000 to $5,000. On the PPOs, it's going to be anywhere from about $5,000 to $10,000. And so it's not going to be zero as far as premium. I mean, it will be zero as far as premium goes, but it won't be zero beyond that because we're going to pay as we go until we hit the annual max out of pocket. Now, over here, we don't pay a lot of co-pays and co-insurance and all the kind of thing because over here, we're going to get a supplemental plan and we're going to have to pay a premium to that supplemental plan, whether that's a G plan or an N plan. And what we're doing with paying a premium is we're getting rid of all the co-pays and the deductibles and all those kind of things, especially if we get a G plan. The only thing you'd be responsible for would be the B deductible. Once a year, this year is $226. So I pay a premium to get rid of all the other out-of-pocket expenses other than my B deductible. So again, I have to pay a premium. For that, I also have to pay a premium, usually $25, $30 or less, for a drug plan, depending upon the medications you take. So this coverage over here is premium-based, and I pretty much eliminated most of the risk of my out-of-pocket expenses. Now, there's another plan called an N plan. The premium is a little bit lower than the G, but again, I'm going to take on a little bit more risk. I got to pay excess charges and co-pays for a few items on the N plan. But what I'm trying to get you to see is when we talk about these plans, we have different out-of-pocket expenses. This is pay as I go. I take on the risk of whatever healthcare services I need. Here, I pretty much eliminate most of the risk, especially on the G plan, because why? I'm going to pay a premium instead. All right, so these plans are totally different. One thing that they have in common would be the B premium, and that's really it. All right, now this fourth piece of bad advice, I've heard this so many times in my career, and that is this. Some people will say, hey, start with that Advantage plan, that replacement plan. Why? Because it has a zero premium. And then when your health begins to change, you can just switch to a supplemental plan whenever you're going to need that kind of care and then start paying a premium. Folks, that is terrible, terrible advice. Now, I would tell you this. Someone can technically do this right here if they live right now in Connecticut, New York, Maine, or Massachusetts. Okay, so those 4 states and only those 4 states have the rule that you never have to medically qualify to get a Medicare supplemental plan. You could be on Advantage and get a supplemental plan, no problems whatsoever in those 4 states. You're restricted to certain times of the year, but you never have to worry about it. But in the other 46, and the District of Columbia, this right here would be terrible advice to act upon. And here is why. Because let's say that I started a Medicare Advantage plan. Let's just say I started it, 1/1/2023. Okay. And then let's say I'm on that plan for 5 years, and now we roll around to 1/1/2028, and now I'm 70 years old, and I just got diagnosed with cancer, or I'm having some kind of a serious health issue, and I want to get off my Advantage plan, and I want to get one of those supplemental plans. Here's what happens, folks. Now, in order to make the switch from the Advantage to the supplemental plan, now you have to go through underwriting. You must medically qualify to make that switch. So if you stay on that Advantage plan a year or longer, sometimes even less than that, in order to get off the Advantage plan, now that insurance company is going to put you through underwriting. They have every right to deny the application. They're going to look at your pre-existing conditions. They're going to ask you 30 health questions. They're going to look at all your medications to see what you're being treated for now or in the last 24 months. And they're going to get a statement from your doctor. And that information is gathered, given to the insurance company, and they have the right to say, no, we're not going to approve that case. So you cannot make that switch without underwriting, except, of course, in those 4 states. Now, when you first go on Medicare, you have this 6-month window before your B date and 6 months after your B date. So if I'm going to start my B date, let's say 1/1/2023, 6 months before I can apply, and then 6 months after, I'm still in this window of time called my Medigap open enrollment period. And during that period of time, there's no underwriting at all. In all 50 states, they have to write you because they can't ask health questions. They have to accept all your pre-existing conditions, and they absolutely will approve that policy. But if you don't start with that supplemental plan, and rather you start with an Advantage, and you stay on that, well, year plus, now what's going to happen? Now you got to medically qualify. So this advice here is terrible, terrible advice. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. And then this last one I hear all the time, and that's this, that everyone really does not have to get a Part D plan. Everyone really doesn't need one. And normally the people who hear that they don't need a drug plan are folks that either take no medications or they're taking cheap medications, maybe a couple generic meds, and they can get those meds cheaper paying cash than they actually could through a plan. All right? And so it's people that take no meds or very few meds or cheap meds can be tempted to go ahead and listen to this bad advice. But I would encourage you, do not do that. Okay? Why? Because all you're doing when you say, no, I'm not going to take a drug plan now because my meds are cheaper, I don't take meds, you're only looking at a snapshot of you right now. I know that in 3 months or 6 months or 9 months, you may get cancer, or you may have some serious heart issue and need Eliquis or Xarelto or some real expensive medication. Folks, right now, if you were taking self-administered chemotherapy pills, and a lot of people are, those cost $7,000 a month. I had a gentleman just recently that takes a medication that literally costs $16,000 a month. He said, Marvin, it keeps me alive. Now listen to this. Right now in 2023, because I did his plan, his very first fill on that $16,000 a month medication, because he had a drug plan, cost him $3,000. That's a lot of money. But after that, he was in catastrophic stage, and that medication for the rest of the year only cost him $800 a month. Why? Because he has a 5% coinsurance on the retail cost of that medication. Now think about it. If he did not have a drug plan, what would he do with the $16,000 a month medication? But because he has one, he paid a fraction of the cost. And again, that's why you get a drug plan, because if you need something that's going to be real expensive, I guarantee you, you're not going to get a great GoodRx coupon or a Cost Plus drug plan coupon on those kind of things. You're going to be begging, borrowing, doing everything you possibly can to get your hands on that medication. But if you have a Medicare drug plan, then it's going to be fraction of the cost, right? So that's why you do it. Listen to this. Had a lady the other day, had a medication she's on that is literally $23,000 a month. Now, that's painful. That's a very expensive medication. Now, again, she had probably out of pocket maybe $3,000, and then she went into catastrophic stage, and that medication probably cost her a little over $1,100 on a monthly basis. But again, a fraction of the cost. Now, remember what I said. This guy here on this medication, this cost him $800 because this year we have a catastrophic stage, which is phase 4 of a drug plan. But in 2024, that is going to be eliminated. Why? Because in 2024, all you have to do is pay your initial coverage, your deductible if it applies, and then there will actually be a donut hole. But we get through all those stages very, very quickly, as in that example of $3,000. And then when you go to stage 4, it'll be a zero copay out of pocket beginning in 2024. All right. And then in 2025, it's going to get better. The most we'll ever spend on meds during the year is $2,000 out of our pocket. You see, so that's why you get a drug plan. So again, that's bad advice because you're only looking at what you're taking now. I'm concerned about what you are going to take in the future. And if you get an Advantage plan, they'll include a drug plan at no cost. And if you actually have to buy a standalone drug plan, those sometimes are as low as $5, $7, $11. And so very, very affordable. So everyone needs to get a drug plan.